And welcome back. This morning in today's checklist, we're going to go over some of the best ways to save money at the doctor's office, whether you have insurance or whether you don't have insurance. Here to break it all down for us is physician and associate professor at Rowan University, Dr. Jen Caudle. Dr. Caudle, welcome back.
Hi, it's good to see you.
So, I mean, what are some of the top things we should be aware of when we go to the doctor's office if we have insurance?
Yes, so let's start with if you have insurance. I tell my patients this all the time. First of all, understand what your benefits are. I know it gets confusing. It can be a lot, but call your insurance company if you're confused, but understand that. Also, know your plan's deductible. You want to know how much you're going to need to pay. And also, something my patients, it's really important when they come to the office, know if you're going to have a copay and what that copay is, and honestly, make sure you have it on you as well. The last couple of things is, I always say, check for prior authorizations. Now, this is not necessarily the patient's job, right? But if you haven't heard about a medicine that your doctor has prescribed or a test you're supposed to get done, you haven't gotten the authorization number, check in with your doctor and be like, hey, what's going on? And then know what systems are in versus.
That's a big one.
It is a huge one because you could be ending up paying more than you want to.
All right, so that's for folks who have insurance.
That's insurance, yes.
Let's talk about folks who do not have insurance.
That's right, which is a lot of us, by the way. First of all, just because you don't have insurance does not mean you can't get medical care. We want you to get medical care. It just might mean you have to dig a little bit more. Inquire about costs. Many doctors' office has fee-for-service or lower costs if you are underinsured or uninsured.
I didn't know that.
And there's also clinics and things like that. Be upfront about your finances. If you have to go to the hospital and you don't have insurance, let them know because they have programs that they can help you with. And then also, look at this. These are the programs I was mentioning. There are assistance programs and also negotiation, which we're going to talk about.
Oh.
You can negotiate bills. It's very important. Yes. So be upfront.
That is very good to know because I feel like you get the bill and you're like, oh, well, there's nothing I can do. I got to pay it.
Oh, my gosh. That's so not the truth. Okay. So I'm a doctor, but I'm going to tell you. Read your bills. Read your hospital. Mistakes are made. Now, it's not intentional, we hope.
But it's also
confusing. It is, but you know what? Take some time and call the number on the back of the bill or call the doctor's office to be like, what is this? And did I need 2 of these? Did I get 2 of these? Also, request an itemization, which means exactly what you were charged for. And then when, I say when, because you very well might find errors, contest those errors. Don't be afraid to say, hey, hey, I didn't do that. I didn't get that. And then negotiating. I mentioned this before, but negotiating we can do with medical stuff, and I think we forget that.
Are there actual ways to save money? Can you get prescriptions cheaper or a cheaper test somewhere else?
Yeah, and as a family doctor, I'm such a fan of this. So first of all, I love it when my patients tell me. I always say, if something's too expensive, like we don't always know what's covered by your insurance. So if you get to the pharmacy and it's $1 million, I tell the people, do not fill this. Give me a call and be like, hey, Dr. Jen, this was way too expensive. We can often prescribe generics. We might be able to give you samples. We might be able to change the therapy altogether. Also, all pharmacies do not charge the same amount for prescriptions.
Okay.
Did you know that?
I did not. So shop around.
Shop around. And also prescription savings programs. There's lots of prescription savings programs.
Okay.
And we have about 30 seconds left.
Yes.
I think this is important. Some ways to save, perhaps, on some of those treatments that you have.
Yes.
All right. So first of all, the wellness exams. Those are free usually, right?
Yeah, oftentimes you don't have to pay a copay if you have insurance, so take advantage of these. Also, if you stay healthy, you get your wellness exams, it might keep you from getting sick later on down the line.
That's fair.
Also, check your rewards system with the insurance company. I get like a $350 gift card every year if I do certain things from my insurance company.
Okay.
Don't leave that money on the table. Consider health savings accounts and flexible savings accounts. But the idea here is take advantage of all the opportunities you're given.
It adds up.
It does.
Dr.
It does.
Jen Caudle, thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.